Hi, my name is Dr. Haroon, and I'm going to talk about brachial plexus. By definition, brachial plexus is a network of nerves that supply the upper limb. By the end of this presentation, you will be able to understand anatomy of the brachial plexus, what are the different branches of this brachial plexus, what are the root values of different branches, and you will be able to identify lesions of brachial plexus. First of all, you have to remember that where the brachial plexus is located. As you can see in this picture, it is located in the neck and axilla both. There are few components of the brachial plexus which are lying above the clavicle, few components are lying behind the clavicle, and there are few components which are lying below the clavicle. We shall discuss these things in the coming slides one by one. And the other thing which you have to remember that how the brachial plexus is formed. Brachial plexus is formed by ventral rami of 5 roots, and they are coming from C5, C6, C7, C8, and T1. So these 5 roots join to form the brachial plexus. Then there are different components of the brachial plexus. As you can see in this slide, there are 5 components: roots, trunks, divisions, cords, and branches. There is a mnemonic called "Real Teenagers Drink Cold Beer." To remember these 5 components, you can remember this mnemonic. Uh, there is always some confusion lying between trunks and cords because there are 3 trunks and there are 3 cords. So by this mnemonic, you can eliminate this confusion as well. So first component is roots. As I mentioned before, they are coming from ventral rami of C5, C6, C7, 8, T1. Then there are 3 trunks: superior trunk, middle trunk, and inferior trunk, and or you can say upper trunk, middle trunk, and lower trunk, and they are formed by these roots. We shall discuss these trunks in the coming slides. Then there comes divisions. Each trunk give anterior and posterior division. In this way, if there are 3 trunks, then there will be 3 anterior divisions and there will be 3 posterior divisions. Anterior divisions, they supply the anterior or flexor compartment of the arm, and posterior divisions supply the extensor or posterior compartment of the arm. Then there comes cords. There are 3 cords: lateral, medial, and posterior, and they are named in relation to second part of the brachial artery. And at the end, and the last component is branches. We shall discuss these one by one in the coming slides. This is the diagrammatic presentation of brachial plexus. As you can see, there are different components of the brachial plexus: roots, trunks, divisions, cords, and the terminal branches. We shall discuss these things in the coming slides one by one. First of all, roots. These are the 4 things which you have to remember about the roots. First of all, they are coming from ventral rami. Number 1. Number 2, they are coming from C5, C6, C7, C8, T1. So 5 roots continue to form the brachial plexus. Then where the roots are located, they are lying behind the scalenus anterior muscle. You can see in this picture, this is anterior scalene muscle, this is middle scalene muscle, and the roots are emerging in between these 2 muscles, and they are in the supraclavicular region. As you can see, this is the clavicle, and they are lying in the supraclavicular region. So 4 things: ventral rami, C5, 6, 7, 8, T1, they are coming behind the scalenus anterior muscle and lying in the supraclavicular region. Again, as you can see, 5 roots and coming from C5, C6, C7, C8, T1. The next component is trunks. Trunks are located in the posterior triangle of the neck. As you can see, this is sternocleidomastoid, and the trunks are lying behind the sternocleidomastoid. And the other thing is they are again lying in the supraclavicular region, just like roots. As you can see, this is the clavicle, and trunks are lying in the supraclavicular region. There are 3 trunks, as I mentioned before: upper trunk, middle trunk, and lower trunk. Upper trunk is formed by C5, C6. Middle trunk is the continuation of C7, and lower trunk is formed by C8, T1. You have to remember this formation and root values as well. Again, in this picture, you can see C5 and C6 join to form upper or superior trunk. C7 continues as middle trunk, and C8, T1 join to form inferior trunk. Then there comes divisions. There are 3 anterior divisions from each trunk, and there are 3 posterior divisions from each trunk, and they are lying behind the clavicle. Again, on this picture, you can see this is the upper trunk giving anterior and posterior division. This is the middle trunk, anterior posterior division, and this is the inferior trunk giving anterior and posterior division. These divisions continue to form chords. First of all, you have to remember that the chords are located in infraclavicular region, and they are named in relation to second part of axillary artery in the axilla. There are 3 chords: lateral, medial, and posterior. And how they are formed, this is very important to remember. If you remember how posterior chord is formed, the lateral and medial chord formation will become more easier to understand. Posterior chord is formed by posterior divisions of all 3 trunks. As you can see, posterior divisions of superior, middle, and inferior trunks join to form posterior chord. The lateral chord is formed by anterior divisions of superior and middle trunk, and medial chord is formed by anterior division of inferior trunk. You have to remember this formation. This can easily be asked in multiple choice questions and in Viva questions. So again, in this picture, you can see this is the lateral chord, this is the posterior chord, and this is the medial chord. And lateral chord is formed by anterior division of superior and anterior division of middle trunk. And medial chord is formed by anterior division of inferior trunk, and posterior chord is formed by 3 posterior divisions of 3 trunks. And they are named in relation to second part of the brachial artery in the axilla. Then branches of the brachial plexus. There are 2 branches which are coming from roots. There are 2 branches which are coming from trunks, and only upper trunk gives branches. There are no branches of the middle and lower trunk. There are no branches coming from divisions, and 3 branches from the lateral chord, and 5 branches from the medial, and 5 branches from the posterior chord. You can remember 22, nil, 355. These numbers can be helpful to remember the branches. 22, nil, 355. So 2 branches from the roots: dorsal scapular nerve and long thoracic nerve, very important nerve from examination point of view, and the root value C5, C6, C7. And similarly, 2 branches from the upper trunk only: suprascapular nerve and nerve to subclavius, and there are no branches coming from divisions. As in this picture, you can see these are the roots: C5, 6, 7, 8, T1, and 2 branches are coming from roots: dorsal scapular nerve and long thoracic nerve, and root value is C5, C6, C7. And in the next diagram, you can see there are 2 branches from the upper trunk or superior trunk: suprascapular nerve and nerve to subclavius, and there are no branches from the middle and inferior trunks. And similarly, there are no branches coming from divisions. Then there are branches of the lateral chord. Lateral chord gives 3 branches: 355, 5 branches from the posterior chord, 5 branches from the medial, and 3 from the lateral. And you can see lateral pectoral nerve, musculocutaneous nerve, and lateral division or lateral root of median nerve. These 3 branches are coming from lateral chord, and root values of these branches are more or less same: C5, 6, 7. Then 5 branches from the medial chord. As you can see, medial pectoral nerve, medial brachial cutaneous nerve, medial antebrachial cutaneous nerve, and ulnar nerve, and medial root of median nerve. So these are the 5 branches from the medial chord. And there are 5 branches from the posterior cord, as you can see in this diagram: upper subscapular, thoracodorsal, lower subscapular, axillary nerve, and radial nerve. And you have to remember the root values of these nerves as well. The last part of this presentation is lesions in the brachial plexus. You have to remember only 3 lesions by detail. First of all, lesion of the long thoracic nerve of Bell. Second is lesion of upper trunk. And third is lesion of lower trunk. We shall discuss these lesions one by one in the coming slides. First of all, very important nerve, long thoracic nerve, root value is C5, C6, C7, and injury of this nerve is caused by sudden heavy loads on the shoulder, or it can be appreciated in people who have the profession where they carry heavy loads on their shoulders, as you can see in this diagram. And injury of this long thoracic nerve can cause winging of scapula. This is the winging of scapula sign. Next lesion is upper trunk lesion. As you can see, the lesion of the upper trunk is called Aub's palsy, and it is resulted from excessive displacement of the head to the opposite side and depression of the shoulder on the same side. As you can see in this diagram, this injury is very common during normal vaginal delivery. When excessive downward traction of the head is caused during the delivery process, there can be injury of the upper trunk of the brachial plexus. C5, C6 roots, they join to form upper trunk, and lesion of this part of the upper trunk also causes Aub's paralysis, and this point is called Aub's point. In Aub's palsy, roots involved are C5, C6, and position of the upper limb is like policeman's tip or waiter's tip hand. In this position, the arm is hanged by the side of the body, or you can say adducted. It is medially rotated. There will be extension at the elbow, and forearm will be pronated, and it will give an impression of policeman's tip or waiter's tip hand, as you can appreciate in this picture. And this is again policeman tip sign in this baby due to Aub's paralysis. And in upper trunk lesion, these 3 things have to remember: that injury of the upper trunk is called Aub's palsy, nerve roots involved are C5, C6, and injury of this lesion causes policeman tip or waiter tip hand position of the upper arm. Then there comes lower trunk lesion. Lower trunk lesion is called clump-case paralysis. It is the root value involved is CHE1, and this injury is caused during birth process. It can be caused by cervical rib, or it can be caused by undue abduction of the arm while holding something with hands during fall from height. As you can see, this is undue abduction of the arm in this picture. And similarly, here you can see undue traction of the hand or arm during hand presentation can cause injury of the lower trunk. Ulnar nerve is the nerve which can be involved in lower trunk, and by the injury of this trunk, there will be paralysis of the intrinsic muscles of the hand, and patient will be presenting with claw hand, and there will be sensory loss on ulnar side of the hand and forearm. These are the pictures of claw hand. So in lower trunk, you have to remember that lower trunk injury is called clump-case paralysis. Roots involved are CAT1, and it causes claw hand. This is the last slide of this presentation, and this is the nutshell. And you have to remember all this information by heart. Any of this information can be asked in multiple choice questions or in Viva. Long thoracic nerve, root value C5, C6, C7, and injury of this nerve can cause winging of scapula. Upper trunk, root value C5, C6, injury of the upper trunk is called Aub's palsy, which leads to policeman or waiter step hand. Lower trunk, root value CAT1, injury causes clump-case paralysis or claw hand. A radial nerve, root value C5, 6, 7, 8, T1, injury of the radial nerve is called saturninite palsy, which results in a wrist drop, median nerve, root value C5, C6, 7, 8, T1, and injury of the median nerve leads to ape-like hand deformity. There are only two nerves in whole brachial plexus which have complete root values: radial nerve C5, 6, 7, 8, T1, median nerve C5, 6, 7, 8, T1, and ulnar nerve root value C8, T1. Injury of the ulnar nerve causes claw hand. This was all about my presentation. Thank you very much. Best of luck for your exams.